Ya, terima kasih teman-teman sekalian yang terhormat Ketua Eksekutif KARS, Bapak Dr. Sutoto MKes Fiskwa, yang terhormat Ibu Lui Harsi MSc Fiskwa, yang terhormat Bu Amatia MKes Fiskwa, yang terhormat Pak Niko Lumenta Fiskwa, Bu Ayi Jembarsari Mars Fiskwa, dan semua teman-teman yang hadir pada malam hari ini. Assalamualaikum warahmatullahi wabarakatuh. Mudah-mudahan kita bisa memulai acara-acara KSK dan SKB yang internasional ya, agar kita melatih pendengaran dan melatih bertanya dalam bahasa Inggris. Jangan takut, nanti akan dibantu. Kalau tidak lancar bertanya, kita akan bantu agar supaya kita terbiasa dalam berkomunikasi dalam bahasa lain. Sebelum nanti IT sudah bisa kita bicara, nanti akan langsung ditranslate suaranya dalam bahasa apapun. Kayaknya nggak akan lama lagi ya Pak Tata ya. Ya, kami mohon di daftar acara Pak Indra di-share. Sudah lebih dari 200. Ya, jadi nanti ini sudah dilakukan pembukaan. Saya sebagai moderator. Topiknya adalah Introduction to UCLA Hospital, Top 5 Hospital in USA and Organ Transplantation Services. Ya, UCLA itu adalah University of California, Los Angeles. Ya, UCLA. Kita tahu main basketnya, ya. Dan sekarang kita lihat berkenalan dengan UCLA, salah satu rumah sakit terbaik di dunia. Mudah-mudahan nanti hubungan dengan KARS semakin baik. Selanjutnya pembacaan doa Pak Joni, ada Pak Joni? Pak Joni di ini
Labuan Bajo ya.
Labuan Bajo Pak.
Sama saya aja ya.
Nggak bisa kan ya
Pak Hani.
Forward. Kemudian kata-kata dari Pak Sutoto. Kemudian kita akan putar film. Ya, ada empat film tentang UCLA yang mereka siapkan. Nanti kita mungkin diskusikan itu sambil menunggu Pak Amer Fakori, Director of Business Development and Patient Navigation and Business Service in UCLA Health, akan masuk jam 8. Jam 8 itu jam 6 pagi di sana. Ya, dan menurut rencananya Alan Tran, salah satu direktur, dan Yana Lim, bos mereka akan juga hadir. Mudah-mudahan bisa menjawab 1-2 pertanyaan. Kemudian kita lanjutkan Q&A sampai jam 21 dan penutupan doa lagi kalau ada Pak Joni atau kalau nggak saya. Kita mulai dengan doa pembuka. Bismillahirrahmanirrahim. Yang terhormat Bapak Sutoto, yang terhormat Bu Lui, Pak Niko, Bu Amatia, Bu Ayi, dan semua teman-teman manajemen, Pak teman-teman surveyor yang sangat kami cintai, dan yang terhormat sahabat-sahabat Civitas Hospital yang ada di seluruh Indonesia. Marilah kita meluangkan waktu beberapa menit untuk beberapa detik untuk menghadap kepada Allah Subhanahu wa taala, bertafakur, merendahkan diri sambil memohon berkahnya agar acara ini dapat bermanfaat bagi kita semua. Doa ini saya bawa dalam agama Islam. Mohon teman-teman yang bukan beragama Islam dapat menyesuaikan. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan na'imin, hamdan syakirin, hamdan yu'afi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu wa lakal syukru kama yang bali di jalali wajhikal karimi wa atimi sultani. Ya Allah, ya Rabbana, Kau menciptakan kami bersuku-suku dan berbangsa-bangsa, ya Allah, agar kami bersilaturahmi. Ya, pada malam ini, ya Allah, kami akan melakukan talabul ilmi pada saudara kami yang ada jauh di seberang belahan dunia yang lain, untuk belajar mengenai segala kemajuan yang mereka dapat, ya Allah. Semoga bermanfaat bagi kami semua, dan juga semoga kita semua memberanikan diri untuk belajar, ya Allah, belajar memahami bahasa orang lain, belajar memahami pikiran orang lain, belajar memahami inovasi-inovasi orang lain, sehingga kita bisa mendapat banyak kemajuan dengan hubungan internasional ini. Ya Allah, berikan kepada KARS selalu terobosan-Mu yang terbaik, ya Allah. Berikanlah kami koneksivitas yang sangat baik ke seluruh dunia, ya Allah. Dan berikanlah kami hubungan yang sangat baik dengan Kemkes dan atasan-atasan kami, ya Allah. Ya Allah, berikanlah kami inovasi-inovasi yang cemerlang agar kami bisa membantu rumah sakit-rumah sakit untuk kelak dengan bangganya dapat diakui sebagai rumah sakit terbaik di jajaran dunia, ya Allah. Ya Allah, berikanlah kami kesehatan, berikanlah kami perlindungan-Mu agar kami selalu bisa maju untuk berjuang demi bangsa dan negara ini. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahirabbil alamin. Amin. Selanjutnya kami persilakan Pak Sutoto untuk membuka dan memberikan sambutan.
Baik, terima kasih Dr. Hani Rano. Bapak Ibu, teman-teman surveyor maupun juga teman-teman rumah sakit dan juga teman-teman manajemen KARS yang saya hormati dan saya muliakan. Knowledge sharing KARS malam hari ini berjudul Introduction to UCLA Health and Organ Transplantation Services. Yang akan berbicara adalah Mr. Amir Fahori, Direktur Development Business, Patient Navigation and Business Services dari UCLA Health, ya. Kita bertemu dengan tim bedah jantung berkat dukungan dari teman-teman Rumah Sakit Jantung Harapan kita yang mana mereka sedang bersiap-siap untuk melaksanakan operasi transplantasi jantung, ya. Kita tentu saja mendoakan dan berharap bahwa operasi transplantasi jantung yang akan dilaksanakan di Rumah Sakit Jantung Harapan kita dengan arahan dari UCLA Health ini bisa berjalan dengan bagus, dengan sukses, dan akan jadi ya kebanggaan kita semangat bangsa Indonesia.
Amin.
Tentu saja kita teman-teman bertanya nih tentang UCLA Health ini akan disampaikan oleh Pak Amir Fahori, Direktur Development Business, yang juga datang ke KARS bersama dengan tim transplantasi bedah jantung, dan kita sudah bertemu dan beliau bersedia untuk memberikan ceramah kepada kita tentang UCLA Health dan organ transplantation, khususnya transplantasi jantung, ya. UCLA Health ini suatu sistem layanan kesehatan yang komprehensif, ya. Mereka punya layanan primer lebih dari 260 klinik di seluruh California Selatan, ya. 4 pusat medis atau rumah sakit, ya. Ada 4, ada di Ronald Reagan UCLA Medical Center, UCLA Mental Children Hospital, UCLA Resnick Neuropsychiatric Hospital, dan UCLA Santa Monica Medical Center, ya. Jadi layanannya sudah berkembang sangat banyak sekali, ya. Dan rumah sakit ini konsisten selama 33 tahun berturut-turut selalu termasuk 5 besar rumah sakit terbaik di Amerika Serikat, ya, menurut US News and World Report, ya. Jadi kalau kita lihat data pasiennya itu setahun kunjungannya bisa mencapai 3,5 juta rawat jalan, dan rawat inap 37.600. Karyawannya juga nggak main-main, total semuanya 33.000 karyawan. Gede sekali ini ya, sistem layanan kesehatan ini ya. Untuk fakultas kedokteran juga untuk pendidikan kedokteran, perawatan ya, juga untuk presiden dan lain sebagainya. Mungkin nanti akan dijelaskan lebih lanjut lah. Saya ingin menyampaikan ucapan terima kasih pada Dirut beserta jajaran direksi Rumah Sakit Jantung Harapan kita yang sudah memperkenalkan kita dengan UCLA Health System ini, dan kita dukung, kita doakan semoga Rumah Sakit Jantung Harapan kita di dalam keinginannya untuk bisa melakukan transplantasi jantung dapat terlaksana dengan baik dan lancar. Baiklah, dengan mengucapkan Bismillahirrahmanirrahim, knowledge sharing KARS malam hari ini saya nyatakan dibuka. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih Pak Sutoto atas sambutannya. Pak Indra, lihat ada Pak Indriwanto nggak masuk? Dari harapan kita ada yang masuk dari jantung untuk harapan kita. Kalau enggak, kita akan mulai dengan mengenal mereka sebelum mereka muncul. Silakan diputar video. Sudah diberikan teks bahasa Indonesia, dan marilah kita melatih telinga kita.
At UCLA Health, it begins with you. From personalized, compassionate care at our 170-plus clinics throughout Southern California, to our 4 state-of-the-art hospitals, the Ronald Reagan UCLA Medical Center, the UCLA Mattel Children's Hospital, the Resnick Neuropsychiatric Hospital at UCLA, and the UCLA Medical Center Santa Monica. Everything we do, from routine checkups to the most advanced procedures and life-changing research, is centered around the lives we touch. UCLA is ranked among the top hospitals in the nation and Los Angeles by U.S. News & World Report for nearly 3 decades. We are a national leader in organ transplantation, ophthalmology, and cancer care. But for all this recognition, it's those we serve who push us to be even better. We're in the community providing care to more than 25,000 children and adults each year who would otherwise have no access to such care. Our UCLA doctors, dentists, nurses, and students volunteer to provide free care to thousands of underserved Los Angeles residents. Our physicians and medical students serve the homeless where they shelter. Our fight against childhood obesity begins with free, innovative fitness programs to area schools. And we are proud to stand by our troops through outreach, surgical, and psychological treatment for injured service members. Our commitment to the best in healthcare and transformative biomedical research has improved the health and lives of people throughout the world. Our global health programs bring the healing and expertise of UCLA to children and families from South America to Southern Africa. It was UCLA researchers who helped develop the life-saving breast cancer drug, Herceptin, reported the world's first cases of AIDS, established the first clinical PET center, and made organ transplants a reality. The David Geffen School of Medicine at UCLA is internationally recognized as a leader in research, medical education, patient care, and public service. As one of the most competitive programs in the country, our distinguished faculty trains a diverse student body to be the best doctors of tomorrow. Above all, UCLA Health is a partnership made up of some of the most innovative and dedicated people in the medical field. Each of us, no matter our role, seek to treat each and every patient as we would a member of our own family. It begins with you. UCLA Health.
Luar biasa. Mari kita lanjutkan dengan informasi yang lebih maju. mungkin bisa ditiru, rumah sakit membuat Children Obesitas Center, ya, dan membantu rekonstruksi pada tentara. Silakan.
Seeing healthy, active 57-year-old Wayne Darrington with his wife and 2 grown sons today, you would never suspect he recently underwent a triple organ transplant: new lungs, heart, and a kidney.
And that's my scar. It's a miracle, and it's nothing short of the miracle.
Wayne, who works for the FAA, has always been the picture of health, but a rare hereditary disease called amyloidosis led to abnormal protein deposits in his organs. By last summer, Wayne was struggling to survive.
He was quite sick. He had heart complications, he was hospitalized multiple times with heart failure. His kidneys were failing as well, on and off, and he had pretty significant lung problems as well.
You know, I couldn't walk from my driveway to my front steps, which was approximately 30 feet, without being short of breath, out of breath completely, frankly.
There is no cure for Wayne's rare condition. Mechanical heart assist devices, including a miniature pump, were implanted into his heart to get him through what would become a 3-month wait.
Finding a donor that matches his blood type, matches his body size, and has good heart and lungs and kidney is a rarity.
In fact, it's believed to be only the 7th such operation in the country. UCLA is among the nation's largest transplant centers, pioneers in innovation, researching new ways to transport organs, with hearts still beating, lungs still breathing in transit, to improve outcomes and expand travel distances for organs to reach their perfect match.
You can imagine doing 3 or 4 organ transplants simultaneously in the same recipient is quite a challenge, even for the most experienced teams. This is an operation that is performed in a few centers throughout the country and under special circumstances.
In August, Wayne underwent surgery and received his new heart and lungs, followed by the transplant of the same donor's kidney.
We looked at his kidney function, and we felt that it was probably the best option for him to undergo a kidney transplant at the same time.
Wayne recovered quickly with a new lease on life.
How are you, Wayne? Oh my God.
And the way that he came out of it and bounced back was just mind-blowing. And then that's when you go, wow, man, you really got all 3 new organs. That's when it hits you.
I feel excellent. I'm back in the gym. I'm doing all the things. I'm back in the office.
Wayne and wife Jennifer are planning to travel, enjoy life, and Wayne says live his best self, to honor the doctors, the donor, and the donor's family, and inspire others facing a similar health crisis and find themselves walking in his shoes.
Hey, but you hang in there, man. What's your name? Fred. I'm Wayne.
Luar biasa, teman-teman. Transplantasi 3 organ bersama-sama ya, jantung, paru-paru, dan ginjal. Kalau kita mungkin baru 1 juga sudah repot, ini 3 sekaligus, jadi menunjukkan betapa advance-nya mereka. Ya, video yang ketiga.
أول مرة طبعا المرض هذا جاني فجأة. كنت ألعب مع أصحابي كرة القدم، وعدت الثلث الساعة الأولى من الكرة، وجاتني الكرة، وما جاتني الكرة دخت وطحت. بعد ذلك اتجهت للمستشفى وسووا لي قسطرة وحددوا لي المرض، وقعدت يعني فترة تعالج من هذا المرض لين ما يئست. قالوا لي خلاص اطلع وازرع في أمريكا. طبعا أنا أحب كرة القدم ومن المتعصبين في كرة القدم، وأحب يعني وكل شيء في كرة القدم يعني حتى إذا في كرة القدم يعني إذا فريقي خسر حكون يومين 3 أيام يعني حزين.
The first time I met Mr. Al-Harbi, I think that the first thing I noticed actually was his smile and his bubbly, personality.
والله بنتي أنا كل شيء أسوي لها إياه. نحب نستكشف الأماكن، نسافر كثير حول لوس أنجلوس.
See the city and be able to, tell me what he saw every visit, and that was one of his favorite things to do.
نعيش الحياة حلوة هذه، نعيشها. وكنت خايف يعني فيني خوف يعني إني أموت بعد خلال العملية.
It really brings me a lot of joy to see him through this journey and to get back to what he wanted to do, which is ultimately to live a meaningful life.
الدكتورة رمزي حتى مبتسمة، وأنا أرشح أي أحد بيزرع خاصة الرئتين وقلب يجي هذا المستشفى، لأني أنا حسيت بارتياح سواء من العاملين، من النظافة، من الأكل، من الإدارة، من كل حاجة. أرجع السعودية والحمد لله أنا عايش حياتي الآن. أنا إن شاء الله حرجع أقوى وأقوى وأقوى.
Ya, teman-teman sekalian, inilah keajaiban yang dilakukan di UCLA Health. Sudah transplantasi paru-paru dan ditolak, dilakukan transplantasi paru-paru bilateral kedua kalinya dan berhasil. Jadi kita lihat bahwa untuk memperjuangkan hidup dari satu pasien bisa melakukan sesuatu hal yang sangat besar. Mungkin video yang terakhir, sambil menunggu, tolong dikasih tahu kalau Amer masuk ya.
Hey, good luck, Mr. 61-year-old Rob Evans from Arizona is getting a new heart tonight in what will be a rare and extraordinary transplant at Ronald Reagan UCLA Medical Center. Rob suffers from a condition called cardiomyopathy. His heart is failing.
Having cardiomyopathy, I've been healthy enough to be able to do the things I needed to do to make a living, but not healthy enough to be me.
Unlike traditional heart transplantation where the donor heart is stopped, put on ice, and transported in a cooler, Rob's new donor heart will be one of the first in the country to span the miles in almost science fiction-like fashion, still warm, still beating, in a box.
This technology takes the organ out of the donor, puts it on a platform where it continues to pump the donor blood into the heart, maintain it in a near physiologic state, in a warm beating state during the transport. This is a clinical trial. Assuming that this technology proves to be as good as the current preservation techniques or possibly superior, this technology opens the door for a new way of preserving organs, improving patient outcomes, and transporting organs from one center to the other.
To tell you the truth, it's a well-duh thing for me. You know, as long as we can, as long as the technology is available, well, it seems like, of course, a warm heart would do better than having to restart a dormant cold heart.
The donor heart arrives at UCLA, beating steadily and continually assessed. Rob's diseased heart is removed, his circulation and oxygen supply taken over by a heart-lung machine. His new donor heart is now briefly put to sleep with special drugs.
All right, there you go.
Removed from the box and sewn into place.
Well, this new technology allows us to take the heart and put it on a machine that keeps it beating keeps blood flowing through the coronary arteries instead of just taking the heart and packing it in ice. And we're hoping to be able to demonstrate that we can better preserve the heart, get better function, and be able to travel longer distances so that we can get more hearts to patients in this area.
We waited 3.5 years for a heart. So, and in that 3.5 years, you're constantly, you know, we had another heart attack, we had pneumonia a couple times, you know, is he going to live to get the heart? Anything to shorten that time frame is just fabulous.
The new heart is working perfectly and everything just turned out great.
To date, all of the patients enrolled in this Phase 2 study at UCLA have done well. Their progress will be rigorously reviewed. Rob and Gail will now be going home to Arizona and hope to resume the active life they love.
Well, first I have to start at the top of my wife's list of things that I have to do when I get back to Arizona. And if I ever make it to the bottom, then I'll be back on my horse and I'll be back running my business. And you know, the respect and frankly love we have for the donor's family will always be a part of our lives.
It's almost like, woohoo, we get a life again, you know?
Luar biasa sekali kita lihat 4 video tentang UCLA Health dan organ transplantation yang sangat luar biasa, yang harus kita ketahui bahwa transplantasi jantung menurut para ahli-ahlinya yang datang ke Indonesia, jadi beberapa dokter yang ada di dalam video itu juga hadir ke Jakarta, ke Rumah Sakit Jantung Harapan Kita, dan mereka menyampaikan bahwa transplantasi jantung itu keberhasilannya 93-97%. Luar biasa ya, 93-97%, jadi hampir sempurna. Tetapi memang untuk mendapatkan donor jantung itu tadi di dalam film itu ditunjukkan bahwa mereka menunggu 3,5 tahun.
Pak Amir udah masuk, Pak Hani.
Ya. Oke, Pak Amer sudah masuk. Hello, Dr. Amer. Very early in the day.
That's okay.
How are you?
How are you? I'm doing well. How are you?
Thank you. Yes, we are fine. Thank you for your dedication for the work. So to give your early morning time, leisure time to give to us in Indonesia. Dear friends, this is Dr. Amer Fakori. Let's have his curriculum vitae. Tolong curriculum vitae-nya. Yeah, that's your CV in Indonesian. Excuse me.
Very nice.
To translate it in Indonesian so people know you. It's your time, Dr. Amer Fakori. Please. Will you?
Oh, are we all ready?
Yeah. Or
yes.
Shall we do
Perfect. Yeah, Dr. Hani, can I ask you a quick question first? Do I need to pause for any type of interpretation, or am I good to just continue on?
No, I think you just keep talking slowly. I think. Yeah.
Sounds good. Okay, I just shared my screen. Let me know when you can see it.
Yes, it's good.
Perfect. Okay. thank you all very much for your time. I'm very happy to be here. Dr. Hani and the team at KARS, thank you so much for the invitation. My name is Amer. I oversee business development for the health system within UCLA. I had the opportunity to visit Jakarta 2 weeks ago now.
Yes.
With the team at UCLA, where we did an evaluation on a heart transplant program at Harapan Kita. During that time, we were also able to meet with the team at KARS and learn a little more about what they do. So as part of my presentation, I'll do a quick overview of UCLA Health, the entire health system within Los Angeles. We'll get into a little more detail on some of our transplant programs within UCLA, so heart, lung, liver, kidney, pediatric, and multi-organ. And then I thought we could just open it up to any questions. I'm happy to answer. I think a couple of my colleagues from UCLA are also on the line, so they can jump in and also answer any questions that you all might have.
Okay.
Okay, so UCLA Health. So UCLA Health is a large health system within the western part of Los Angeles. I don't know how familiar you are with the area, but it's in a city right in between Santa Monica, Beverly Hills, in LA. And UCLA Health is an overarching umbrella of the organization. It's kind of twofold. So underneath that larger umbrella is the health system. That's 4 hospitals and about 250 clinics that are situated all throughout Southern California. Our academic institution is the David Geffen School of Medicine. That's where a lot of the clinical research, research themes, basic science department educational programs are housed. What bridges the two together is the clinical departments. So the physicians that teach in the medical school, they practice within the health system. So in the inpatient and outpatient settings within the clinics and the hospitals. So just some numbers, just to give you an idea of the magnitude of the organization. We see about 710,000 unique patients a year. These are patients coming in for anything from primary care to specialty care, complex surgery, oncology, etc. We have about 3.1 million outpatient clinic visits a year, 65,000 emergency department visits between the 2 hospitals, or the 2 campuses, I should say, and 35,000 hospital stays within the organization. We have about 31,000 employees. Of those, there's 4,400 registered nurses and 3,300 total faculty. So about 3,100 of them are clinical faculty. Those are those that are providing care to the patients that we mentioned earlier. So this is going to give you an idea of the magnitude of the organization. So Westwood is right here where my cursor is. That is where the main hospital is and the main campus. It is also home to a lot of the specialty clinics and primary care clinics that we have. But we're kind of spread out all throughout Southern California. So we go up north into the Central Coast, down south into Orange County and into the Inland Empire. The U's here that are represented in blue are facilities that are owned and operated by UCLA Health, and then the gold U's are our affiliate partners or community partners spread out through the city. Ronald Reagan UCLA Medical Center is the main center. It's our probably the most well-known hospital of the bunch. It's a level 1 trauma center. It was opened in 2008, and it was a replacement hospital to the original UCLA hospital, but it was built to meet California seismic standards. The facility is about 1.1 million square feet and is 10 floors, so 2 underground and 8 up. It is in total within this larger building, there's about 540 beds, but for the adults, there's 446 licensed inpatient beds. The UCLA Mattel Children's Hospital is located on the same campus as the main center. It's about 134 patient beds between the 2 hospitals. And then our second campus is located about 3 miles away from the main center. It's about half the size, 281 licensed beds and 525,000 square feet. Ronald Reagan UCLA has about 24 operating rooms, whereas the Santa Monica Hospital has about 16. In terms of awards and recognition, so UCLA Health has ranked amongst the best hospitals in the country. According to the U.S. News and World Report rankings, we're currently in top 5, and we've been enrolled in this honor for about 33 consecutive years. We've been a top 20 hospital in the country. On the right-hand side of the screen are specialty areas in which we're also ranked. So these icons that you see at the top that are in gold circles, those are our specialties in which we're ranked top 5 in the United States, and those in silver on the bottom are those that were ranked in top 10. The one that is not on here that's noticeably missing based off of the topic of our conversation today is transplant. So transplant is not a specific service line. So there's no national rankings in terms of the U.S. News and World Report rankings. However, we're the top transplant hospital in the country in terms of volume. So we do anywhere between 700 and 1,000 transplants per year. I'm going to stop right here because we're going to get into transplant programs. I will go through some of the solid organ transplants and some of the statistics that we have, and then also I'll get into a little more about the novel treatments and kind of best practices of UCLA. Okay, so like I mentioned earlier, the UCLA Health Transplant Program has done more solid organ transplants than any other center in the United States. Last year, we performed more than 700 solid organ transplants, but we're not just here to do the volume of transplants, we also do quality transplants. So our outcomes excel national averages in every aspect. And UCLA acts as a transplant center for other institutions within the United States. So we take on the complex transplant cases that other institutions aren't able to handle. Even with those complex cases, our outcomes, our survival rates are still above average and beat our colleagues that refer those complex patients to us. We have expertise in pretty much all organ transplantations, but just to name a few, we have a bone marrow transplant, which is not solid organ, but we do corneal transplant, face transplant, hand transplant, heart, intestinal, pancreas, lung, liver, kidney, and we do pediatric transplants. We're one of the only centers that does both adult and pediatrics in the world. A few things to note: face transplant is a new program within UCLA. It's still in the clinical trial phase, and we're actually enrolling a first candidate for that, hopefully sometime soon. So getting into heart transplant. So we had a chance to talk a little bit about heart transplant when we were in Jakarta, but just to give a bit more context. So our heart transplant program at UCLA is one of the largest and most successful programs of its kind. It's existed since 1984. We've performed over 2,000. I think we're closer to 3,000 now. Adult transplants, and then 300 pediatric heart transplants. UCLA is a pioneering institution, not just for heart transplantation, but for pretty much all solid organ transplants. And we're a prominent referral center for treating complex cases, like I mentioned earlier. Other facilities deem some of their patients unsuitable for transplants, and because of the expertise of the facilities, our physicians, and protocols that have been put in place, we are able to offer those patients transplants. In terms of outcomes, our adult patients have a very low 5% donor heart rejection rate. The national average is about 25%, and our patient survival rates, both for 1 month, 3 month, 1 year, and 5 year post-transplant, consistently surpass expectations across the board. We're in a unique situation in the institution where we're able to transition a pediatric heart transplant patient into adult heart transplant. The programs work very closely together, and there's a transition protocol for when a patient is ready to transfer their care from the pediatric unit to the adult heart transplant unit. In terms of innovation, I think that's what we want to learn a little bit more about what makes UCLA unique amongst other transplant programs. So we utilize advanced techniques, and because we're an academic medical center, a lot of the research that we're able to do on our campus is transitioned into practice within the clinical institution. To name a few, so we've developed a specialized blood test where our physicians are actually able to detect early transplant rejection within transplanted patients. Our protocol at UCLA for biopsies is within the first month of transplant, we do one heart biopsy a week up until the first month. From month 2 to 3, we do them every 2 weeks. And then after that, we do them once a month for basically the first six to 9 months, just to make sure the organ is doing well. And then after that, it's usually done once a year. But this new blood test kind of minimizes that long term, so they'll no longer be required to do a heart biopsy procedure on a yearly basis. They're able to do a blood sample, and from that they're able to detect the rejection, and they can bring the patient in and either switch out the medications, change things up, or determine how to best move forward based off of the results of the blood test. So artificial heart and ventricular assist device. So we have expertise in providing the mechanical circulatory support for these patients. It initially started out as a bridge to transplant. So when a patient was either too sick or was waiting too long to get the organ, they would put them on the VAD, and it was a temporary fix until that patient was able to receive a heart transplant. But they've become so advanced now that a lot of times a patient no longer requires a transplant when they're on this device. So we pioneered a use of smaller total artificial hearts, and the VAD. There's been innovations within the VAD device with patients that are already transplanted and they've are in heart failure. And Heart in a Box is probably one of the most unique. I think when I logged in, you guys were watching a video on Heart in a Box. It's a specific device called OCS, and it basically is a glass box in which we're able to harvest a donor organ. It gets hooked up to the donor's blood, and it basically mimics the chest cavity. So it's almost like the organ is not taken out of the donor. For the recipient, it pumps blood throughout the vessels, and it gives us an opportunity to extend the donor pool, because then we're able to receive organs from further locations. Typically, when an organ is removed from a body, there's a set amount of time in which they're able to transplant the organ. So this allows us to extend that. So especially for patients that might have a specific criteria for heart transplant, so O positive patients, they tend to have a longer wait time due to the availability of organs. But with this new Heart in a Box device, the OCS device, they're able to actually expand the donor pool to other areas within the United States and bring the organs to the hospitals for transplantation. Another one of our major solid organ transplants is lung. So we're one of the country's most successful programs of its kind. We've done about 1,500 lung transplants since 1988. And again, we consistently rank among the top programs in the nation by volume. Lung transplant is very complex, and we have a team of not only lung transplant surgeons, but pulmonologists, critical care, ICU physicians that approach lung transplant in a multidisciplinary way. Again, we routinely treat patients who are turned away by other centers, even whether they're local within Los Angeles or within the United States and international. and we have the highest survival rates in the regions, and the survival rates, again, they consistently exceed national averages due to the expertise of our physicians and the protocols put in place for these patients. And again, we excel in performing these transplants for previously ineligible patients. So whether they're redo transplants, they might be deemed and uncompliant by other centers. But again, our physicians are able to take more of a risk in accepting specific organs that other institutions may not accept. They're able to optimize them and transplant the patient to give them the opportunity. It leads to shorter wait times at UCLA, lower mortality rates compared to the national average, and we specialize in these unique lung transplant surgeries. So not just a single lung transplant, but we do double lung transplant and we do multi-organ transplants that I'll get into in a little bit. In terms of innovation, so again, there's specific criteria within each transplant center in the United States, and UCLA's criteria for accepting donor is a little more relaxed. But again, it allows UCLA to offer more transplants to patients, and we're able to get them transplanted quicker than other institutions within the United States. Again, similar to the heart in the box transplant that I mentioned, there's a similar technique for lung. It's called the breathing lung transplant. And again, it takes the lungs from the donor, puts it in this clear box. It mimics the lungs were still within the chest cavity, and it's actually oxygenates the lungs. They're able to expand and breathe within this box until they're ready for transplantation for the patient. Again, because UCLA is an academic campus, if you guys have ever been, the hospital is on one side, and right across the street is the medical school, and that's where all the research is done. We can offer breakthroughs in clinical trials pretty quickly, and our work and the research work and the clinical trial work that's done at UCLA not only benefits our patients, but they're taken across the board within the United States and the world, and they're able to improve clinical results for all patients, not just our patients at UCLA. In terms of liver, so we have one of the largest liver transplant programs in the country. We were one of the first liver transplant programs to exist. We've performed more than 6,000 liver transplants to date. And again, it's an internationally recognized program. It's a pioneering institution for liver transplant, and a lot of the standards of practice used across the world for liver transplant was developed at UCLA. We consistently meet and exceed national averages in both patient and graft survival. And we're a center of excellence provider, again, in a referral center for complex cases. We do a lot of transplants for organs that are not deemed eligible at other centers. So we'll get into that in just a minute, but we coordinate with, again, a multidisciplinary team within UCLA to make sure that the access to care for all liver diseases that require transplantation is available. We're able to offer transplants for cholangiocarcinoma cases. We're one of the only centers that does this. So when a liver has this specific type of cancer, it also affects the bile ducts in which that they use to connect the donor organ to the recipient. So a lot of centers just deem these patients as ineligible for transplant, but what we've been able to do is treat the patient for their cancer with chemo, rad-onc, all of that. The surgeons go in, they optimize the patient, they fix the bile ducts, they get the patient ready for transplant, and then they go ahead and transplant them. And their survival rates and the success on those beat the national standard across the US for survival rates. So it's a pretty incredible program. We're one of the only programs in the West Coast, the Western United States, to offer living donor transplantation. So that's when they take a piece of a recipient, a piece of their liver, and they're able to transplant it into, they take a piece of the donor liver they're able to transplant it into the recipient, and the organ just regenerates in the donor, and then it grows in the recipient. So that was actually pioneered at UCLA in the early 1990s by a famous liver transplant surgeon named Ron Busatil. He's actually still around at UCLA. He's no longer practicing, but he's there to provide support, teach, lecture for current liver specialists. And then on the bottom, this kind of just goes through the journey. Since it is a living donor, they're able to actually schedule the time of the surgery so they can both prep the donor and the recipient. They typically operate on them simultaneously, where the surgeons remove that portion of the donor's organ or the donor's liver, and then they'll at the same time remove the recipient's failing liver. They will then transplant it into the recipient. On average, it takes 5 to 6 hours for the donor and about 10 hours for the recipient. And then the donor is usually able to go home in a day or two, whereas the recipient stays in for a month or two just to make sure that the organ is doing okay and it's functioning properly within the recipient. And then last, in terms of kidney transplant program, is our kidney transplant program. So we have the largest kidney transplant program in the country. The program began in about 1965, and since then we've performed over 8,000 kidney transplants per year. Currently, we do about 400. So as you can imagine, in 1965, when the program began, we were doing maybe 1, 2. Over time, that has expanded, and more recently, it's closer to 400 a year. That's both for living and deceased donor transplantation. The outcomes and survival rates are consistently higher than national average. That seems to be the theme for all of our transplants. And the numbers are impressive because, again, we take on these very complex cases that are denied or deemed ineligible for transplant by other organizations in the US and abroad. In 2015 at UCLA, we opened up a very unique transplant center called the Connie Frank Kidney Transplant Center. And it's a multidisciplinary team that works in one setting that provide patients access to the kidney transplant team and to kind of take care of everything that's needed for these patients in one specific spot at UCLA. So a program that we wanted to highlight that is fairly new, and it's currently only being done at UCLA, we're a pioneering institution, is called the Kidney Tolerance Program. And basically what happens is when a patient, any organ transplant patient receives an organ, they're put on anti-rejection medication for life. And what people don't realize is these medications dwindle your immune system, and then it also you're at a higher risk for cancer. And what Dr. Veal is one of the kidney transplant physicians and surgeons within UCLA, and he developed this novel innovation where he simultaneously does a bone marrow transplant in the recipient with using the blood cells from the donor. So what that does is when you place the organ inside of the recipient, instead of the organ or instead of the body rejecting it and seeing it as a foreign body, it actually sees it as a part of the body. So when you take the donor, their organ and their blood cells, the stem cells, and you inject the stem cells into the recipient and then also put in the organ, it no longer sees it as a foreign body. It sees it as part of its existing body, and it will in return, the recipient will no longer require to be put on any anti-rejection medications for life. It's currently being done only for kidney. The plan would be for it to move on to other organs, and it's currently only offered to well-matched siblings to make sure that they're they're a match in terms of stem cells, and then obviously the organs, HLA matching, etc. So pediatric transplant. We are, like I mentioned a bit ago, one of the only centers in the United States that does both adult and pediatric transplants within the same facility. It's really unique because when a patient comes in for a pediatric transplant for whatever organ it might be, typically in other centers, they at some point when they become 18, 19, whatever age is the cutoff at that specific center, they're required to go to another hospital to continue care once they transition to adulthood. And that doesn't allow for continuity of care for these patients when they're already receiving complex care at one institution. So at UCLA, when a patient is receiving care, has been transplanted, is on a transplant wait list, they're able to stay within the same institution. The physicians within the pediatric programs work closely with the adult programs, and they're able to smoothly transition that patient on and provide that continuity of care that's so important for the health of the patient and the survival of the organ that has been transplanted. So we wanted to just talk quickly about a few of the pediatric transplant programs that we have. So pediatric heart transplant, the program began in 1984. We have performed about 300 heart transplants in children. It's not as common as adult transplants, but we again are a major referral center for children's heart transplants. So we regularly treat the children with rare and complex pediatric conditions. One of the big ones is congenital heart disease. So the anatomy of a heart with congenital heart disease is very complex and it requires very subspecialized training. And we have a full team at UCLA that's trained to care for these patients and then also to transplant them once an organ becomes available. And again, that program, the continuity of care from pediatric to adult is seamless. That was actually the same program within UCLA for that specific disease. And it's one of the only programs in the US that transplants patients with congenital heart disease. In terms of kidney transplant, the pediatric kidney transplant program has performed about 900. I think it's actually closer to 1,000 now. And that makes us one of the highest volume programs in the country in terms of pediatric kidney transplant. Again, the experience of our kidney transplant surgeons are unmatched, and we're able to consistently lead the nation in outcomes and volume. And those best practices that are established at UCLA are used worldwide for organ transplantation. And then finally, pediatric liver transplant. So the UCLA liver transplant team within the larger adult team has a pediatric team. And they're working on ways to expand donor options through new surgical techniques. So now we're able to offer actually adult to child living donor transplants when needed. Again, we also perform those split liver transplants where we're able to use a living donor. They take a portion of the liver from the donor. They're actually able to split it into two and offer the transplant to two different patients. Again, the organ regenerates, and I think it's within a year. It's fully functioning liver, just like any other liver would. And finally, multi-organ transplants. So we're a leading institution in terms of organ transplant. And because of that, we're also able to provide multi-organ transplants to patients. So a lot of times when a patient is requiring a heart transplant and they're on the wait list, their kidney begins to fail, they go on dialysis and they also require kidney, again, liver, etc. So we have the teams work closely with one another. We have established programs for multi-organ transplant depending on the type of organ. And we're able to offer the organ transplants to these patients. So they'll use the same donor, the same donor for both organs, and they'll simultaneously transplant both organs into the patient. So a few that we're able to do are heart, liver, kidney, liver, intestine, liver, heart, and lung. But we've also done 3 organ transplants where we're doing heart, liver, kidney, heart, lung, liver, heart, lung, kidney, etc. So we're able to get that done for the patients, and those are some of the cases that get referred into UCLA. They're at other centers in the U.S., Cleveland Clinic, Mayo, etc. They're not specialized in multi-organ transplants, so the patient is transferred over to care at UCLA, and we're able to do that for the patients. And again, the outcomes far exceed national averages. So the heart and lung transplant program, their survival rates are same as a single organ transplant for heart or a single organ transplant for lung. So it's a very successful program within UCLA. Okay, so that is what I have for you in terms of a presentation. It was a lot of information all at once. Dr. Hani, I don't know how you want to go about questions, etc., but I'll leave that to you.
Yeah. Okay. Thank you, Dr. Amel. Please give applause to Dr. Amel for his excellent speech. Dr. Amel, there is still one question or two questions, but can you take off the screen share, slide share, and maybe can we give a little time for Yana and Alan to say hello to us, to see the team of Dr. Amel. Please, Yana, tolong di slide share, Pak Indra, UCLA 1 dan UCLA 2.
Hello,
Yana and
good evening.
Alan, can you open your video?
Hello. I'm
Hello.
unfortunately not on video. It's very early here. I apologize.
Yes. Okay.
But good evening, everyone. Thank you all so much for having us. Thank you, Dr. Hanyu, for putting together such a great seminar opportunity for us. We really appreciate and are grateful for this collaboration with KARS and look forward to continued work together in Indonesia. Thank you.
Thank you very much. That's Yana Lim, the boss, your boss of Alan. Yes, Alan, can you have some words for us?
Yeah, absolutely. Thanks, Amber, for a great presentation, and thanks, Dr.
Video.
Hanny.
Yeah, okay. Yeah.
Yeah, thanks, Dr. Hanny. And
yeah. Can you put the video again?
oh, is it not working?
Yeah, okay, working. Yes.
Oh, great. Yeah, thanks, Dr. Hanny, for having us this evening. Great presentation, Amber. He and I were fortunate enough to meet with you, Dr. Hanny, and the rest of KARS in person 2 weeks ago as part of our on-site needs assessment for Harapan Kita, who is looking to embark on the first heart transplant program in the country. We also met with RCM, who has already established several organ transplant programs. And I must say, overall, we were very impressed, not only by what we witnessed at these 2 hospitals, but the overwhelming support of KARS and the Ministry of Health and the rest of the country to elevate healthcare in Indonesia. So we really look forward to continuing the engagement with you and Harapan Kita and Ministry. Thank you.
Thank you very much for your time early in the morning for our friends in United States. There's some questions, Emer, from Lince Gultom. This is our surveyor. How long will it take the heart to keep beating before it's been transplanted? Put in the box. So how many hours, how many days can it live in a box? Thank you.
So in the box, it's usually not longer than a few hours. Even though you want it's basically mimicking like it's beating inside of the chest cavity. It's flowing blood through the vessels and everything, but you still want to get that heart transplanted pretty quickly. So it's not usually more than 24 hours, but it depends on the organ. It depends on a few other things. So we recently did the first one just in March. and it was transplanted. The heart was transplanted within 12 hours.
So the patient, the donor patient comes to the United States, so it's more easier to take some. It's like
Yeah,
that?
so that one was done. The organ was taken from another state within the United States. So generally speaking, when we do organ transplant within the U.S., where it's regional based, so there's UNOS is the overarching umbrella. It's the Organ Procurement Organization, and within that there's regions. So we take organs within the region, but for heart in the box and the breathing lung transplant, we're now able to go out of state to get it. So a team will fly. They will harvest the organ. They will hook it up to the box. They will set everything up, and they will fly back with the organ to UCLA.
Yeah, thank you. There's another question from Indah Maulina Dewi. I want to ask Dr. Amer, is UCLA Health working together already with Harapan Kita Hospital for telemedicine and transplantation?
So we are working with Harapan Kita to help them hopefully develop their heart transplant program. We completed the first phase, which was a site visit for an assessment. We will send them our notes and then discuss continue working with them and scoping out the subsequent phases of the collaboration.
Yes, thank you. Jadi Bu Indah, kita sampaikan bahwa kita kenal dengan Amer dan Alan pada waktu kunjungan mereka ke Harapan Kita. Jadi mereka datang ke kita. Jadi mereka membina Harapan Kita. They supervise the program until the first heart transplant in Indonesia. Hopefully it will work. Okay. And then from Sri Yulia Hartati. Good evening from here, Sri Yulia from Indonesia. I want to ask, how long is the life expectancy of the patient who have liver transplant in children? As we know, usually children have a long life for their family.
So for pediatric patients, life expectancy is usually longer than adults because they're more resilient. And then their immune systems don't take as much of a hit as an adult patient. I don't know the number off the top of my head. I can get the answer for you, but I believe it's about 15 to 20 years.
Okay, thank you. Then I see in the film that there's the heart lung transplant from Saudi, the football player. It's rejected already. And then he got a second transplant. And I think if it's 15 years, then maybe the baby, the child will get another transplant to prolong his life. Is it?
Yeah. So for Osama, he was actually he received his first transplant in the United States at another hospital in Los Angeles. He was, I think, 25 or 26 at the time. He received a double lung transplant. He was in respiratory failure. He actually went back to that institution when he was going into organ failure, and they said that he was not eligible for transplant. He was then referred to UCLA. Actually, one of my contacts at the hospital reached out to me and asked, and we sent it out to our physicians. Our physicians reviewed the records. We brought him to UCLA. They did the full evaluation on him. He was accepted. He was listed and then transplanted 3 weeks later. And he's doing well. He actually just reached out to me about a week ago. He wants to come visit, and he wants to come see his doctors, but he's doing very well. I think now he's 31 or 32. He has a young daughter, but that's the level of expertise that UCLA has. When other centers reject these patients that have young kids and have a family and have a life outside of the clinical part of their journey, and UCLA is able to a lot of times offer them that little glimmer of hope and that that offer them the transplantation.
Yes, thank you. There's another question from Dr. Tamrin Hatna. He is asking about how to cope with the GCI standards, because it's a very business oriented procedures. Is it difficult to do with the hospital to do the GCI standards for transplantation?
So you said JCI, right? Joint Commission.
Yes, JCI.
Because UCLA is a very well-oiled machine, it's not very difficult. We've done it for so long, and policies, procedures are already put in place that are adamantly followed. It's not very difficult. It's just like any other institution going for JCI accreditation.
Same ya. Oke, ini jawabannya jadi sama aja, tidak ada kesulitan. From Ramli Isakuku from Makassar, from South Sulawesi, Dr. Amer, Mr. Amer, according to your statistic notes, among adult patients underwent heart surgery, heart transplantation, how many person had experienced rejection process? Until right now, how many percent mortality rate among the adult transplantation heart transplant patients?
So it's over 95% survival rates. If you give me a second, I'll actually give you the exact number because I have it. 1 second, and I'll tell you exactly what that number is. But our 1-year survival rates are usually above 98%. Okay, here it is. So for adult heart transplant, our 1-year survival rate is about, on average, about 95%. So in 2020, for example, we were at 100%. In 2019, we were at 94% of 1-year transplant survival. For a pediatric heart, across the board, we have 100% survival rates. For heart lung, we also have 100% survival rate. And for lung, we average out about 93% survival rate for 1 year post-transplant.
And how's the longest survival rate until now for heart transplant?
Oh, that I don't know. I would imagine very long, but I'm not sure.
Okay. Yes, Alan, if you can answer, just feel free to come. And from Sri Mulyani, this is the question is in Q&A. Yeah, Mr. Amer, thank you for your inspiring knowledge. I have several questions. 1, how is your country regulation about living donor? Do you always use living or cadaveric donor? It's impossible a cadaveric donor. Yeah. Second one. Is there any issue when the patient use living donor, and how do you solve the issue? 3, how to monitor the patient so that the treatment time in the ICU is only 1 day, or the length of stay is only 7 days? Thank you.
Okay, so the first question, there is regulations for living donors. It's all done by a regulatory body, so it's not done per institution. It's federal guidelines that every transplant program has to follow. It's very complex. There's a long list of them that I'm not going to go through now, but it's not done per institution. They're federal guidelines that each institution has to follow, including not just for the procurement of the organs, but also allocation of the organs for transplant. So for example, organs go there when a patient is listed for organ transplantation, they're listed at a different status. And essentially, the sicker the patient is, the quicker they get the organ. And there's a set protocol, procedures, policy set in place. So there's never any question on where an organ should go. It's already set and predetermined, and nobody can can alter that at all. For your question about always using liver or cadaveric donors, it depends on the organ. Obviously, for heart, we can't use a cadaveric donor. I'm sorry, a living donor. But for kidney and liver, we're able to do both, living and deceased donor. So for kidney, for example, in the United States, the wait list is about 10 years for a kidney transplant. So if a patient is able to find a matching donor, then that would probably be the best way to move forward. For your second question, on using a living donor, if there's any issues. So there, depending on the individual program, there's specific criteria of who can donate the organ. A lot of times it needs to be a relative or a close friend. They both go through an extensive workup that includes psychiatric workup, etc., just to make sure that the donor wants to do this in their free will and they're not being forced to do it or paid to do it, etc. So there hasn't really been any issues because it's so highly regulated and monitored. And then your third question about the ICU stay. So it depends on the organ, it depends on the complexity, and also depends on how things go. So I recently visited a heart transplant patient probably 2 months ago, and I went and saw him about 24 hours after his surgery. He was already sitting up on a chair. Within 36 hours, they had him up and walking, and he was transferred to a regular bed within days. So there's also a very, each program has a very aggressive post-transplant protocol because they want to get that patient up and going as quickly as possible to make sure that the organ survives. But it depends on the organ. It depends on a number of things, but they try to get them up and at them as quickly as possible.
Yes, thank you. I just remember if I read the question from Sri. If a hospital in the United States wants to start with transplantation, do they need a special permit from the MOH or something to check whether they are surely they can do it, or any teaching hospital can do that? Start with
so it requires some levels of approval. It's not really within the MOH or the government. They'll go through it is a permit. They'll go through a site visit and they'll determine whether or not they're ready. They have to have certain things checked off a list, basically, to make sure that they're ready for organ transplant. And then the physicians and the surgeons are trained specifically for transplantation.
Thank you for your answer. And from Erna Suyati, dear Mr. Ahmed Fakhoury, in heart transplant program, the success rate is 73 until 77, 93 until 97%. What is the success rate if multiple organ doing in one operation? It depends.
So it depends on the organ. Usually the survival rates are higher than the individual organ. So for example, I just for heart lung, our 1 year survival rate for heart lung is at 100%. So every heart lung that we've done has had 100% 1 year survival rate.
Okay, and then I want to ask you that from your presentation, you start a heart transplant in 84 with 2,000 adults and 300 pediatrics. Lung from 1988 with 1,500. Liver from 1993 with 6,000 patients. Kidney in 1965 with 8,000 adults and 900 pediatrics. I want to ask, is there no rejection difficulties anymore, because we are not used for transplantation, so we are always in our mind that the rejection rate is very high. But to
Yeah.
see so many things, I think you overcome it already.
Yeah. So I mean, there's a risk in every surgery that you do, not just with transplantation, right? So there's always that risk of complications. It's not there's always going to be some type of rejection. I will say that from the beginning of the programs to where they're at now, it's significantly improved, and rejections are only a tiny percentage. But they will always be there for any program. The best program will always have some level of rejection, because you don't know what the body is going to do after it's been transplanted and organs placed into a recipient. But I will say the survival rates have gotten a lot better, obviously, from 1984 to 2023. But there will always be some level of rejection.
Yes, thank you.
And then I'm sorry, really quick, just to know, also the medications have come a long way with the anti-rejection medication, so that the continuity of constant research and kind of altering procedures, protocols within each department also improves that. So they're able to, like I mentioned with the heart transplant program, with a simple blood test, we're able to detect early rejection of the organ. And from that, we're able to alter the medications. We're able to do different things to hopefully get that patient out of rejection or prevent them from going into organ rejection.
Thank you very much. Yeah, I was thinking, Alan, if it's possible that we have a next lecture from you about how to overcome the rejection, the body rejection to the transplant. Maybe later. Okay, there's Dr. Karunia. I want to ask you about how to prepare the patient for transplant, for organ transplantation.
So patients at UCLA go through an extensive evaluation. It's either done on an inpatient or an outpatient basis, and it's a multidisciplinary team that assesses all aspects of the patient to make sure that they're optimized for transplant and they're able to be transplanted. No patient will be offered an organ if they're not approved by a committee. So once they've gone through a full workup, the case is presented in a multidisciplinary committee, and they determine whether or not a patient's able to be listed. So I guess there's not a specific prep. There is education. There is informed consent on the patient. There's a whole protocol for it, for a patient. And then once they're offered the organ, once an organ is offered and the institution accepts, they also have to go in and do new informed consent. So they go in. There's a full team of transplant coordinators that provides education in terms of the anti-rejection medications, what they can and can't do, etc. So there's a whole approach and procedures and protocol put in place for each individual organ, but it's generally similar amongst all of them.
Yes, thank you. There's a good night. Good night from Kusnadi Jaya. It's very early in the morning there. 8 o'clock in the morning. It's here. It's very late at night. We are half of the world on the outside. I want to ask you about one thing, intriguing question. Do you know about the molly ship? They make the ship without sperm in London, and then later on they find out that the baby coming from Molly and is the same age with the donor. So the ship died more quicker than before. Now I want to ask you about a donor heart, not heart, but maybe liver from adult to children.
Yeah.
Do the cell age it's from the donor is older than from the it doesn't matter anymore.
So
LH.
So that is something new that UCLA is offering to patients. It does matter, but UCLA has set up. They've done research and they're now able to offer it to children. So I mentioned earlier, children, their immune system is a lot better and they're more resilient than adults. So they're now able to do it. There is specific criteria, specific policies, procedures, protocols for them. I don't know what they are off the top of my head, but there is to make sure that the child is eligible for it and they're able to receive it, and then they will likely go on the same anti-rejection medications that would normally happen. But there is specific
treatment.
Yeah.
So we just look at the function. If it's still functioning, then we still go on.
Yeah.
And then this is from our police general, Dr. Purwadi, our friend. Do you have legal problems? You have talked about already legal problems, because the heart transplant must be living, and also the lung, lung and heart.
No,
must be
a
living
heart and
donors,
lung needs to be deceased, a deceased donor.
Deceased, but still living, But I mean, multi-organ failure or already in coma or something like that. But
they needs to be it needs to be harvested within. I mean, they need to be like brain dead, for example. But the organs still need to be viable, and they need to remove the organ pretty quickly after the patient is pronounced dead.
Yes.
There's a specific time. I don't know it off the top of my head, that they need to remove the organ from the donor for it to be viable for transplantation.
Okay, thank you. And then from Karunia, how to prepare the donor? There's a special procedure. It's very complicated. You have said already.
Yeah.
And from Kusnadi Jaya, to observe the high transplantation success rate, how about the sterilization of your operate theaters? How to keep it? Must be 100% sterile.
Yeah, there's the full team, just like any other OR. So transplant is not done in separate ORs. They're done in the same ORs as other surgery. So we don't have specific transplant operating rooms. So it goes through the same sterilization process as any other surgery that we do at UCLA. So I'm sure it's very similar to how things are in Indonesia. There's a red line. You can't go past it unless you're sterile. It's sterile field. You can't go in and out, and all of that. So it's the same process as any other surgery.
And if you have confidence in the operating theater, you don't give antibiotics?
What do you mean?
You just give prophylaxis antibiotics and not after that, because the operating theater seems to be very well coordinated, so it's no infection coming from the operating theater.
Yeah, I'm not sure what medications they give patients. It's my understanding that antibiotics are only given if an infection is there. I don't think they give it as a preventative measure, but I'm not sure, to be in full transparency.
Okay, thank you. This is from Cinderella Riopasa. Good evening. So Cinderella is watching you also. I saw that your institution can do transplant organ from adult to child. How you made it in order to fix it in a child? Do you have a special policy for liver transplant?
Yeah, so that's the one that we already answered. We only do adult to child transplant for liver. It's not for any other organ. And there's specific policies and there's specific criteria for those patients. I don't know exactly what they are off the top of my head, but there is specific criteria for when we're taking an adult donor for a pediatric recipient.
Yeah, maybe Cinderella was thinking that the whole liver from an adult going in the pediatric.
No, yeah, no, it's just a piece of it.
Just a piece of it. Yes, Cinderella.
Yeah.
Yeah,
because when they're selecting any organ, not just for liver, there's a lot of criteria. So they look at the weight, they look at the size, they look at a lot of that in order to determine whether or not they can transplant that into a recipient.
Okay, thank you. This is our very clever ophthalmologist, Lina Yulianti Priyatno. Dear Mr. Amer, thank you for sharing. I want to ask you, how do you get the donors? How to get the donors? Either UCLA Health or the patient seek it. You put it in the driver license.
So it's on the driver's license, but it's something that we struggle with just as everywhere else in the world, because there's not enough donors to make the need for organs. But it's done on your license. There's a little pink dot if you want to be an organ donor. But it's like I said, it's something that they need to do on their own, like at their own will. But we do struggle with it. It's something that can be helped through campaigns and just getting the word out on the need of it. I know within the U.S., once a patient is put on life support and they might get ready to take them off of life support, a conversation will happen with the family on if they would be willing to be donors, organ donors. So there's a lot of different things you can do. There are conversations with the families, campaigns, social media, just building the awareness of organ transplantation and the need for donations, etc. But just like you all, we also struggle with it. I know there has been talks within Indonesia about an opt-out program where you're automatically a donor unless you opt out of being a donor. That to me could be a solution, but I don't know. I think there's a lot of politics involved in making that decision that is over my head.
Yes, thank you. So I just want, there's organs, human organs that are single, just like the heart. It's difficult to transplant because it must be living, yeah. But about the lungs, you have two lungs. If you transplant, you give one lungs, both can still live.
So but it's only so if a patient only needs one lung, they will do the one lung transplant. This the single lung transplant. But if they need both of them, then they do the double. So some patients only need a transplant of the left lung, for example.
Mm-hmm. Yeah. Okay. So for the lung, you can give half. If from the liver, maybe a part of it. From the kidney, from the heart, it must be whole. Okay. From Retno Kusumo, we are from private hospital, and we have complete services except transplantation. We want to develop our COE for transplant service. Which organ is easier to start?
I'm sorry. Say that one more time.
She want to her hospital, maybe it's a big hospital, private hospital. You want to start with transplantation services, and she asks you which one is the most easier to start.
Oh, I don't think that any of them are easy to start. I think it's I don't
everything
think
is difficult.
I don't know if you can answer. It's I feel like they all are they're all difficult in one way or another. So I don't know if it's easier to start with one over the other. I think they should probably look at what the needs are and then determine from there what organ they start with.
Mm-hmm. Oh, yeah, okay. And then this is from East Timor. Maybe you know the Komodo Islands, Al-Harani, Koni, Londa, Manu. This is a very beautiful place. You should come one day. She wants
Yes,
to
I would
ask
love
you
to.
some simple questions. how does it cost?
Yeah, so that's a very loaded question. So the cost of organ transplant within the United States, I think you asked specifically about heart transplant, right? So it depends on a number of things. So in the US, the cost of healthcare is dependent on the cost of living, and the cost of living changes amongst state by state. So at UCLA, the cost of a heart transplant is right around 1.1 million. But that includes the evaluation, the actual transplantation, and 3 to 6 months of post-transplant care. And that's just the flat cost. It doesn't include any discounts that may be applied, etc.
Yeah. Okay. Thank you very much. And from Munjari. Yep.
Resign udah lama.
Oh, udah resign. Sorry. Siapa yang resign ya?
Saya Niko.
Oh, Pak Niko. Ya, Pak Niko, silakan.
Oke.
Tolong dibuka ininya, videonya. This is on our senior nephrolog.
Oh, udah buka dari tadi.
Udah, ya.
Oke. Dr. Amer Ke-40, thank you for your excellent informative presentation. I'm Nico Lumenta. I'm from the Board of Management of KARS. You present to us, to me especially, in the world of transplantation, giants of data. Giants of data, yeah. I have some experience in kidney transplantation. Around 1977, the first kidney transplantation in Indonesia, done in the General Hospital and the Cikini Hospital, a private hospital. I work in the private hospital. So the first transplantation kidney, solid organ, is in 1977. But I was overwhelmed by your giants of data. You have 700 to 1,000 transplantation per year. My question is, what is the percentage of multi-organ transplantation from 700 to 1,000 transplantation?
Yeah. So it's a small percentage. It's not, I don't know the number off the top of my head, but if I had to guess, it's 5 to 10%, if that. It's not a big percentage at all.
And the survival rates is much lower?
No, it's much higher. So it's actually for multi-organ transplants, the majority of the time, our survival rates are usually above 95% either way. Yes. But for multi-organ transplants, they're even higher than that. So for heart-lung, for example, our 1-year survival rates are 100%.
Yeah. Could you explain why is that difference?
If I had to, in my opinion, it's because it's a very specific. It's a very specific need, and it requires a lot of coordination and a lot of an extensive workup, and they're sure that that's what's needed, but I'm not 100% sure why, but the survival rates, generally speaking, are better than a single organ transplant.
Is it usual that the receiver is more sicker than ordinary transplantation?
Yeah, they could be, but you don't want them to be too sick, right? You want them to be, I mean, it sounds a little morbid, but you want them to be sick enough for a transplant, but not too sick to not be able to receive an organ. So it's a balance, I guess.
We saw your video, Mr. Dwayne, received 3 organ transplantation.
Yeah.
What is the main obstacle for having donor? Maybe specific heart and kidney transplantation, main obstacle to having donors.
What do you mean by to having donors?
the obstacle? What is the difficulties to having donors?
So I think that people just are not aware of organ transplantation. They're not as aware as they should be about organ transplantation, and I think that's a big problem in terms of gaining the number of donors or organs for patients. So we have a regulatory body called UNOS, and UNOS is what determines. They do a number of things, but they are an organ procurement organization, and they are responsible for listing patients, and they're responsible for kind of that awareness part of things. So each individual hospital does not recruit donors. Essentially, if there is somebody on life support, they can approach the family. But UNOS is the one that lists them. They determine where the organs go, where it's allocated, and they also they keep track of all of the details on the recipients and the organs, so they make sure that they're doing the correct match.
Okay, last question is, in kidney transplantation, you mentioned the advanced technology. You plant cells or glomeruli, or what kind of cells?
Yeah, so they do a bone marrow transplant. They'll take the donor and their organ, and in the recipient, they'll inject the bone marrow. They'll do a bone marrow transplant, so the donor cells are in the recipient, and they will do the transplantation so that once the organ is inside of the recipient, it no longer sees it as a threat or as a foreign object in the body. It sees it as its own because they've already put in the bone marrow transplant from the cells of the donor into the recipient. So then they will no longer require anti-rejection medications.
Very good.
What about the kidney transplantation? Do they plant the organ itself or some kind of cells?
No, they plant the organ itself.
Okay. Thank you, Mr. Amer.
Yep.
Just to continue the question from Dr. Nico, Amer, the difficulties, the obstacles to get the donors. Do you have a large transplantation campaign with celebrities maybe talking that I want to donor my heart or something like that? So
we should. Being in Los Angeles, we should utilize that. But we don't. We have physicians that try to champion organ donation, and campaigns aren't really done through UCLA for organ transplantation. They should be done on a national level, and UNOS should be the one to do that. But I mean, in hindsight, I think it's everybody's responsibility to get the awareness out there and campaign and for it. But I would love for the celebrities to do that.
Because you are in the neighborhood of Hollywood.
Yeah, we're very close. We're in LA, so it'd be the perfect place to have them lobby for us.
Okay, so let's finish some questions. What about from Munjari? What about the universe coverage? Do they cover transplantation?
You mean the insurance?
You
right?
have what do you call it?
Covered California. Yeah, Medi-Cal, Medicare. Yeah,
Medicare.
It does cover transplantation.
Okay.
That's a cover transplantation. Yeah. The last one from Purwanto. Purwanto. Mr. Amer, good evening. I want to ask what kind of multiple organ are very common in UCLA.
So I don't know if there's one that's more common than the other, but it's a lot of times kidney begins to fail when a patient is is waiting for an organ. So I would say probably heart, kidney is the common. I don't know the stats, so this is just a guess on my end. But a lot of times that's the first organ to begin failing after like the patient's waiting for a heart or a liver, etc.
Okay.
My last question, Dr. Amer. We have seen in films that people anywhere, because of poverty, they molested children to take the organ and then sell to the hospital. It's impossible, isn't it?
Oh, that does not happen at UCLA. They don't, because you can't, like I said, there's strict policies and there's strict, it's highly regulated for living donors. So that does, no. Yeah.
And I think it's also impossible because the aseptic procedures. No,
yeah.
just take the kidney and give it to sell it. Something like
Yeah,
that.
it doesn't work that way. Like you can't take a kidney to a hospital and tell them I want you to transplant this in me. So I don't see a way that would happen.
Okay, thank you, Mr. Amer and Mr. Alan. Maybe some words from you, Alan. Your mic, yeah.
Yeah, no, I just want to say thank you again for the opportunity. Amber, you did such a great job representing UCLA. These were amazing questions, and I love the enthusiasm seeing almost 400 people on the call today. I know it's pretty late over there. So Dr. Hani, Dr. Nico, thank you again for having us. We look forward to continuing the engagement and hopefully we could be back in the future.
Yes, maybe we can meet again for the new technique about rejection, just like the bone transplant. Maybe somebody can talk from UCLA Health for us, so just to lever up our knowledge. Thank you very much. Maybe Yana, you want to have some words? Oh no, maybe she's on.
I think Jana's on another meeting.
Yeah, already.
Yeah.
Hello. Sorry,
hello.
I'm
Yes,
about
there.
to go to another meeting, but thank you all so much. This has been a wonderful opportunity. And again, we look forward to working together again soon.
Yeah, okay. Thank you
Have
very
a good
much.
evening, everyone.
Thank you. Thank you. Good morning there. And maybe this will not be the last, but this is the starting of our good cooperation. And of course, we are very grateful to you because you're on the upper side and we are on the lower side. Yeah. Maybe Dr. Sutoto can give some closing statements in Bahasa, maybe. Pak Sutoto?
He's on mute.
Any? Or
Dr. Sutoto's on mute. Yep, there he goes.
Okay.
Oh, nope, he's back on mute.
Thank you, Dr. Hani. On behalf of KARS and knowledge sharing KARS participants, all of participants, more than 400 people from all over Indonesia. They are from Aceh, which is the westernmost province, and from Papua, easternmost province of Indonesia. I would like to thank you for your excellent and informative presentation. And I hope on another occasion, you and the UCLA Health team can talk again at another CAST event. And I'm very surprised that UCLA has done with multi-organ transplant remarkable. We hope that Indonesian hospital can follow in the footsteps of UCLA Health in terms of organ transplant, especially heart transplant. And okay, I will close the KARS event tonight by saying Alhamdulillah.
Okay.
Thank you, Dr. Hani.
Thank you. Ya, teman-teman kita tutup dengan doa. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan naimin, hamdan syakirin, hamdan yuafi ni'amahu wa yukafi mazida. Ya Rabbana lakal hamdu wa lakas syukru kama yang bali di jalali wajhikal karimi wa timi sultanik. Ya Allah ya Rabbana, kami bersujud kepada mengucapkan syukur atas nikmat yang luar biasa ini ya Allah, bahwa kami bisa bersama-sama dengan para ahli dari ujung belah dunia yang berlawanan dengan kami, tapi kita bisa berkumpul melalui teknologi sehingga kami bisa saling berbagi, melakukan tolabul ilmi. Ya Allah, berikanlah kami selalu rahmat-Mu, berikanlah kami selalu berkah dan perlindungan-Mu. Semoga kami sehat dan semoga kami Kau berikan izin untuk berbakti bagi negara dan bangsa ini agar kami bisa membawa kemajuan pada rumah sakit di seluruh Indonesia menuju rumah sakit yang terkemuka seperti UCLA. Terima kasih. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillah. Maybe we make one photo first before you close. Yes. Bye. Okay, thank you very much.
Thank you very much, Amer, and
Thank you,
also Alan.
Oh, we are
See you next
for your
time.
health and your success. Home,
Thank you very much.
Thank you.